that dividing the axillary artery, the first part. Are you starting?
Yeah.
Done. First part, which is proximal to the pectoralis minor. Second part, the portion behind, posterior to the pectoralis minor. The distal is the third part. Three parts. Okay. So for convenience, you are just lifting this one, and I cut the axillary vein and kept it away. Now we will see the branches of the axillary artery here, or we'll go for the relations of the first part. This is the first part. The first part of the axillary artery. What all thing was here? Skin, superficial fascia, deep fascia, and the pectoralis major, isn't it? Pectoralis minor was not in the scene. Okay, anterior relation of the first part. Okay, posteriorly means if I touch here, I'll be reaching the first and second two digitations of the serratus anterior muscle. Here, first and second digitation of the serratus anterior will be there here. Okay, along with that, medial cord of the brachial plexus will be the medial cord of the brachial plexus. Okay, medially, always on the medial side of the axillary artery, we have the axillary vein. Okay, laterally, this is the lateral aspect. Here we have the both lateral as well as the posterior cord of the brachial plexus. Okay, done?
Yes.
Now coming to the second part is damn easy. All the cords are lying according to the name. That means laterally lateral cord, medially medial cord, posteriorly posterior cord. Okay. Apart from that, we have the medialis axillary artery, posteriorly subscapularis. Okay. Now coming to the third part. You can see here, third part partly cover the pectoralis major is partly covering the third part. If this much area is covered by the pectoralis major, but the lower portion only by the skin and fascia. Anteriorly, you have the skin, superficial fascia, deep fascia, and the pectoralis major in the upper portion. Okay. Posteriorly, you have the subscapularis, teres major, and the latissimus dorsi. Okay. Now, medially, axillary vein. Between the axillary vein and the axillary artery. This is the axillary artery. This one, deeper one. Okay. This is what I'm holding with the right hand is the median nerve. Okay. This is the axillary, third part of the axillary artery. Between the artery and the vein, we have the medial cutaneous nerve of the. This is. Medial cutaneous nerve of the arm will be medial to the axillary vein. Okay. Here behind the gap we have two structures. This is the medial cutaneous nerve of the forearm. This is the ulnar nerve. Medial to the axillary vein we have the medial cutaneous nerve of the arm. Okay. So this make the medial relation. Medial cutaneous nerve of the arm, axillary vein, medial cutaneous nerve of the forearm, ulnar nerve. Okay. Laterally here you can see the lateral root of the median nerve. Here you can see across the third part of the axillary artery, the medial root of the median nerve, what I'm holding now, medial root of the median nerve crosses in front of the axillary artery and join with the lateral root to form the trunk of the median nerve. Trunk of the median nerve lie lateral to the third part of the axillary artery. But in the middle of the arm, the nerve crosses the artery from lateral to medial. That means crosses the brachial artery from lateral to medial and simply descend down to enter into the cubital fossa. Clear? So laterally we have the lateral root of the median nerve, and we have the median nerve. Okay, and coracobrachialis. This is the coracobrachialis. Is that clear?
Yeah.
So this is the relation of the axillary artery. Then we'll. They have removed the pectoralis minor to show you the first part, the second part behind the pectoralis minor, and third part distal to the pectoralis minor. You can see few branches are arising from each part. Okay. They have removed a portion of the axillary vein, and you are seeing the artery. So you can, how many branches are running downwards? 1, 2, 3. 3 branches are running downwards, and you are seeing 1, 2, 3. 3 branches are running upward. Okay, so 3 plus 3, 6 branches. From the first branch it arises 1 branch, from the second part 2 branches, and from the third part 3 branches arises. So let's see the first part of the relations of the first part of the axillary artery. Which is the first part? The portion proximal to the pectoralis minor. Okay, isn't it? So what are the things you removed here? You have removed the skin, you have removed the superficial fascia, you have removed the deep fascia or pectoral fascia, and what was lying over here? Pectoralis major. So naturally these are the things which make in the anterior relation. If you dig up in the deeper part, you can see the first 2 digitation of the serratus anterior muscle. Okay, and the nerve supply to that is the long thoracic nerve. That makes the posterior relation. Coming to the lateral relation, the lateral relation is the lateral and posterior chord of the brachial plexus. The chords of the brachial plexus are named according to their position around the second part of the axillary artery. They are named according to their position around the second part of the axillary artery. That means the posterior chord lie posterior to the second part, medial chord lie medial to the second part of the axillary artery, and the posterior chord lie posterior to the second part of the axillary artery. But in the first part, both lateral and posterior chord lie lateral to the first part, whereas the medial chord lie posterior to the first part. Okay, the axillary vein is always medial to the axillary artery. You can see it. I'll show you. This is lateral. This is medial. This is anterior. What is making the bed for the vessels and nerve is the posterior. Okay, this is lateral. Above, what you're looking like above is actually lateral. What is looking like a below is the medial. Okay, what is lying over it is the anterior. What makes the bed is the posterior. Okay, so your medial chord lie posteriorly, other 2 chords are lying laterally. This is the axillary vein. Throughout its course lies medial to the axillary artery. The same thing in a diagram, schematic diagram, you can see it like this. Anteriorly, skin, superficial fascia contained in the platysma, pectoral fascia. What these dots are the supraclavicular nerves in the superficial fascia. So skin, superficial fascia contained in the platysma and the supraclavicular nerves, pectoral fascia over the pectoralis major and the pectoralis muscle itself. And the communication between the medial and lateral pectoral nerve are also seen anterior to the first part of the axillary artery. This is the medial pectoral nerve. This is the lateral pectoral nerve. Okay. What is posterior? Is the First two digitations are the serratus anterior, long thoracic nerve and the medial cord of the brachial plexus. Laterally, lateral and posterior cord of the brachial plexus. Medially, axillary vein. Clear? So, this is the second part of the portion underneath the pectoralis minor. Okay, so what all thing you have taken out? You have taken out the skin, superficial fascia, then pectoral fascia, pectoralis major and the pectoralis minor. Okay, then you can expose the second part. Same thing they are going to. Anteriorly, skin, superficial fascia, deep fascia, pectoralis major and pectoralis minor. Posteriorly, posterior cord of the brachial plexus and subscapularis muscle. Laterally, lateral cord of the brachial plexus. Medially, medial cord of the brachial plexus and the axillary vein. Yes, schematic diagram. Anterior, posterior, medial, lateral. Okay, anteriorly you have the skin, superficial fascia, the deep fascia, pectoralis major and the pectoralis minor. Posteriorly you have the posterior cord of the brachial plexus and subscapularis muscle over which the vessels are lying. Medially you have the axillary vein. Medial to that you have the medial cord of the brachial plexus and the medial pectoral nerve coming out of the medial cord. Laterally, lateral cord of the brachial plexus and the short head of the biceps and coracobrachialis muscle partly. Now third part of the axillary artery. The portion lying lateral to the, that means distal to the portion of the artery distal to the pectoralis minor is the third part up to the teres major. That means up to here. This is the latissimus dorsi. This is teres major. So exactly up to here. From here to here. This is the third part. Okay. So here you can see one nerve is crossing the axillary artery, isn't it? One nerve is crossing. This nerve is the medial root of the median nerve, which unites with the lateral root of the median nerve to form the trunk of the median nerve. So what is running lateral to the axillary artery is this is the trunk of the median nerve. Okay. So what all thing you are seeing here? Medially completely axillary vein. Laterally coracobrachialis. This is this one. Can you see this nerve is entering into this muscle? You are seeing two muscles here, isn't it? One this tendon and below that you are seeing something fleshy portion. The tendinous one is the short head of the biceps. This one, what I am touching right now. Okay, this thing, this one. Then this below that, this muscle is the coracobrachialis. Okay. So laterally, coracobrachialis and the biceps. And naturally the humerus in the tubercular region of the humerus. Medially, you have ulnar nerve and the medial cutaneous nerve of the forearm in between the axillary artery and axillary vein. The gap between the axillary artery and the axillary vein, we can catch two things. Superficially, more superficially will be the medial cutaneous nerve of the forearm. A bit deeper but thicker one is the ulnar nerve. Medial most structure in the axilla is the medial cutaneous nerve of the arm. The floor, the bed The bed for posterior relation of the third part is this one. What I am touching, this muscle is the subscapularis. Then this two muscles are there actually. This one, this is the teres major, and this whitish thing is the latissimus dorsi, this tendinous fascia kind of stuff. This is the latissimus dorsi which lie over the deeper fleshy portion. This is the teres major. More medially, this is the subscapularis. If you lift the axillary artery on the bed of this muscle, we can have two things, the radial nerve and axillary nerve. So radial and axillary nerve lie deeper to the posterior to the third part of the axillary artery. If I lift the axillary artery, you can see two things. Large and thicker one is the radial nerve. The axillary nerve will be running for a short distance and disappear from the axilla to enter into a space called quadrangular space. We'll see that. Yeah, line diagram, skin, superficial fascia, the deep fascia. Pectoralis major will be in the upper part. See here, I told you the extent of the artery is up to here. So if I can take out the pectoralis major, this is the cut end of the pectoralis major. So the third part of the axillary is partly covered by the pectoralis major. If I extrapolate this line up along this way, you can see it covers the artery up to here, not beyond it, isn't it? So the third part partly covered by the pectoralis major, partly simply skin and fascia. The upper part is covered by skin, superficial fascia, the deep fascia, pectoralis major, and the medial root of the median nerve. That's what I told you here. This is the medial root of the median nerve. Crosses the artery from medial to lateral to join the lateral root to form the trunk of the median nerve. Okay. Now, posteriorly, you have the subscapularis. Between the artery and the muscle, we have two things. They are the axillary nerve and the radial nerve. Between the axillary artery and the axillary vein, we have two things, ulnar nerve and the medial cutaneous nerve of the forearm. More medial to the axillary vein, we have the medial cutaneous nerve of the arm. Laterally, lateral root of the median nerve, musculocutaneous nerve, which entering into the coracobrachialis muscle. We have seen all this stuff. This is the coracobrachialis muscle. This is the musculocutaneous nerve entering into it. This is the lateral root of the median nerve. Okay. The third part, lower portion, where the pectoralis major is not uncovered by the pectoralis major. The skin, superficial fascia, deep fascia, no pectoralis major intervene here. Okay, so here is the artery, medial to artery, axillary vein. Again, ulnar nerve and the medial cutaneous nerve of the forearm lie between the artery and the vein. Medial to the vein, medial cutaneous nerve of the arm. Okay. Laterally, we have this is the trunk of the median nerve, coracobrachialis and the biceps. So lateral to the third part, we have the trunk of the median nerve. And in the lower part, only the radial nerve is seen. What about the axillary nerve? In the first diagram, we have axillary nerve and the radial nerve side by side. But the axillary nerve in the lower part leave the
axilla to enter into a intermuscular space called quadrangular space through which it enters into the deltoid region to supply the deltoid and the skin over the deltoid.